Friends, this is Dr. Joe Planansky, Northern Colorado Nutrition and Chiropractic in the Neurometabolic Center of the Rockies. Today we're going to talk about chronic knee pain solutions. And I'm excited to talk about this because I have benefited from what we're going to be talking to you about. Growing up, I played in a lot of sports and have a lot of chronic knee pain up until a couple months ago, and was getting tired of one, having the pain, or two, having to manage the pain with things like Aleve, ibuprofen, or I guess the next step probably would have been pharmaceutical pain meds. And if I would have kept going down the path I was going, a total knee replacement was probably in the picture for me. I don't really want that, so I called a couple of colleagues that I have. One lives in Wisconsin, one lives in Missouri, and they both treat chronic knee pain very successfully. I wanted to learn what they were doing. So over the last couple months, I've gone through some training with them. I've gone through the exact things they do with their patients, and lo and behold, I would say my knee pain is reduced by about 80 to 90%. That's what I'm going to talk to you about today. Some of the patients that my colleagues are seeing, they're even bone-on-bone patients, meaning that their tibia and their femur are actually bone-on-bone as visualized by x-ray. And after going through these protocols with them, they were virtually pain-free as well, saving them from total knee replacements as well. So what makes their approach unique and what gives them great results is, one, the thoroughness of the exam. So when we're talking about knees, and you'll have to bear with me, I'm not an artist, but the knee sits in the middle of the hip and the foot. So if we don't look below the knee at the foot and the ankle, or above the knee at the hip and even the lumbar spine, we could miss what's causing the dysfunction and creating the pain in the knee. So when we do an exam on you, we do a thorough exam. We start at the floor and we work up to the low back. The low back, you may ask, why are we addressing the low back? Well, the low back houses, or the lumbar spine, it houses the spinal cord. And from the spinal cord come the spinal nerve roots that go all the way down to the feet. So these spinal nerve roots are what control the muscles around the knee, around the hip, and around into the foot. So if there's any dysfunction going on in the lumbar spine, that could translate to pain in the knee. So tell me, how would a total knee replacement ever solve the problem of something going on in the lumbar spine? It wouldn't. So that's why we have to look there. Also, we assess the soft tissue or musculature around the knee. We look at the muscles on the inside of the leg, what we call the adductors, the muscles on the outside of the leg that we call the abductors, the quadriceps on the top, the hamstrings in the back, and right behind the knee, a small little muscle called the popliteus muscle. And I'll tell you what, that popliteus muscle, that's unlocked a lot of chronic knee pain in people. So if you have chronic knee pain and you're seeing a doctor or a therapist or an acupuncturist or whoever you may be seeing, a chiropractor, and they're not addressing the popliteus muscle, tell them, hey, check out the popliteus muscle. It could be the key to what's going on, all right? Now, I was really excited about this, and I told you I was going to prove to you how excited I am about it, and here's what I'm willing to offer you. For $47, we do a thorough exam all the way from the floor up to the low back, see if we can isolate what's going on with that knee pain. After that, you get 2 free visits to experience the therapies. The therapies are laser therapy. The therapies consist of pulsed electromagnetic frequencies, rapid release techniques, and then conditioning and strengthening techniques of the muscles. So you get a $47 exam, 2 free visits after that. Now, are you going to be pain-free after those 2 free visits? I don't think you'll be pain-free, but the goal is to see some reduction in the pain. If we can get some pain reduction, then we know we're on the right track. For $47, what have you got to lose? All right? The only way that we can see if we can help you is you have to get into the office. So give us a call, 970-797-2434, or you can email us at info@noconutrition.com. And the final way would be to leave a comment underneath this video, and either me or the staff will get back to you as soon as we can. All right? Any questions whatsoever, let us know. We can help you. $47 gets you the initial exam and 2 visits. If you have any questions, you got to let us know. Again, 970-797-2434. This is Dr. Joe Planansky. Thank you.